When you've just had a baby, you keep them in your arms, and to have that child in another room and undergoing procedures that you know are not simple and they're not painless it's horrifying. It's horrifying. She was born at home, completely uncomplicated delivery, and to me didn't seem quite right away. Call it mother's instinct. She was diagnosed with multiple heart defects, and they didn't say that she wouldn't survive, but they did say that it was going to be hard work, and that there would be multiple surgeries after that, and that it would be very difficult to predict how many complications she would have. It's amazing how quickly it becomes normal to go to the emergency room on a regular basis, and how it becomes integrated into your life.
One of the things that's changed most in emergency medicine over the last 20 years is the utilization of emergency departments. When I started here, Children's Hospital was seeing about 35,000 ill and injured children a year, and that was 4 years ago. Last year, we saw almost 48,000 ill and injured children. That's on average 130 per day, but in the wintertime, we can see over 200 children in a single day.
I don't put my pajamas on anymore, and I don't dress my other children in pajamas. They wear tracksuits to bed, because when I get up in the middle of the night, I have to take all of them. My husband travels a lot, and when I have to take all of them, it takes too long to get everybody dressed, so it's much better if we don't get into our pajamas.
As the tertiary referral centre for the entire province of BC, we see a lot of complex children coming through our emergency department that are dependent on technology.
The amount that she worries when we're packing up to go, do you think they're going to have to start an IV? Do you think the IV team's going to be there? Is Carmen going to be there? She knows the people that she trusts.
Unfortunately, because of the nature of their illnesses, they do end up coming frequently to our emergency department and often get painful and anxiety-provoking procedures like getting a bladder catheterization or an intravenous start. And sometimes these can be really difficult procedures to do. We're hoping that with ultrasound guidance, our success rate can be much higher and thus reduce the anxiety and discomfort that these patients feel in our emergency department.
So point-of-care ultrasound is one of the examples of a quantum leap in technology that is changing the way we care for children and adults. Point-of-care ultrasound is different from what many people have experienced in a radiology department. And it's a machine that is available at the bedside in the emergency department for the emergency department team to help with diagnosis, treatment, and procedures.
Really, it's become so small and portable that we can now bring the ultrasound machine to the bedside and make diagnoses in a critical time fashion, meaning that there's no more delay or wasted time in finding out what is wrong or what's causing this child to be really sick in our emergency department. We find by bringing this technology to the bedside, we can make wait times shorter, increase our efficiency, and have more timely diagnoses as well.
We expect with the opening of the new Leadcore Children's Emergency Department, with its increased size and capacity, that will serve even larger numbers of children in BC.
Currently, there is no training program in Western Canada for point-of-care ultrasound in a pediatric hospital. With the help of donor dollars, we're hoping to develop this program and be real leaders in this field. Support for this program will allow us to educate all of our staff physicians, our pediatric emergency medicine trainees, our emergency nurses to use this technology and integrate it into our department as well.
One of the things that we have kept, and I'd say this is probably half of them, is hospital bracelets. And it's a bit of a shocking image, but we have a few from hospital stays. They didn't say too much, other than the fact that she would not be an athlete. And guess what? She is. Her team is extensive, and all of them, without a doubt, always have her best interests at heart and have saved her life so many times and improved the quality of her life so many times that I can't even express to you the gratitude that I have.